We are headed to Okoboji Wellness Clinic for another edition of Wellness Wednesday. Good morning, Dr. Meyer.
Hey, good morning, Dave. Good morning, everybody.
We are going to talk about, with Dr. Bradley Meyer from the Okoboji Wellness Clinic, we are going to talk about ozone today.
Absolutely. Ozone, we've been working with this incredible approach on mitochondrial enhancement, boosting that immune system, increasing that energy, a year and a half now. And we continue to expand the different ways that we are able to provide this treatment. A lot of different approaches for it. Of course, over the months, we've talked about things like IV ozone. We've talked about folks that are suffering with back pain, shoulder pain, knee pain, joint pain. I like to say that anybody that's been having pain and just from a day-to-day basis struggling with a stiff back, and trouble getting that arm up over the head, wrists that are hurting, carpal tunnel, weakness sometimes in the hands, the application of and the results that I've seen over the course of the last year and a half just absolutely continue to amaze me. And again, I always say it's such a conservative approach and safe approach to work with that before we do anything, thinking about anything more aggressive down the road for joint conditions, I certainly think it should be in everybody's thoughts of something that they want to try prior to doing anything surgical.
Okay, now let me interrupt you here if I can, because I've just read an article on this within the last 7 days about people that take shots in joints like knees and wrists and things like that, steroid shots. This particular study said long term, if you keep doing this long term, not a good thing.
And so, albeit steroid shots, cortisol shots can have an effect in a positive way on pain, it has been tied to decreased bone mineral density, a suppression of your immune system. And so there's limits to how many of those you can get. And there aren't with ozone therapy. Ozone therapy it's antimicrobial. It's 3 oxygen molecules, and it is something that when we administer it, because it's antimicrobial and there's no steroid in it, you can have them on a regular basis. So this is what will end up happening, where we try to do a bolus on the front side, and this bolus for, let's say, a knee or a shoulder or a low back may look like something once a week. Maybe we'll do it a little bit more frequently than once a week. And then eventually we go to every other week, and then we kind of space it out further. Typically after about 6 or 7 treatments, hopefully at that point we are seeing dramatic change. Sometimes it's after 1 or 2 we'll see a dramatic change. But once we hit a plateau, and for some folks that plateau will be 100% improvement. Some folks it may be 95% improvement, which is pretty good if it's something they've been dealing with for many years and is limiting them in a significant way. And then after that, it may last in an extended period of time. Like some folks it's been indefinitely. Some folks it's many months, many weeks, and then they'll come in and feeling like maybe they need a little booster. So again, even in some of the most difficult cases, it's worth a shot. There's, of course, always surgery. We're grateful for our amazing surgeons out there and orthopedists, but when it becomes a point where there's mechanical stuff going on, like bone on bone or a bulging disc, whether it's in a back or a knee, it certainly still, in my opinion, is worth a trial of ozone therapy. Of course, sometimes when we get to a mechanical space where there's just nothing left in that joint, in that realm of having to work on some of those surgical options, of course. But again, the amount of times that I have seen this have dramatic change for folks in so many different ways, so many different applications. From IV, we had, again, I think I shared this a couple of weeks ago about a gentleman coming from quite a distance getting IV therapy and talking about a T-shirt that this stuff works is what it should be stated. He's like, I haven't had this amount of energy and felt this good in ages since he started the intravenous ozone, where we take blood out, put the ozone gas into the blood, and infuse it back into you. It's about an hour procedure. But the applications, joint particular, here's one really exciting story from this last week. And this is probably one of my favorite things to do now, is Prolozone is what it's called, or ozone injections, is a gal we've been working with for a while now, and we've tried a bunch of things, and we've made some progress, but we hadn't made the big progress for the one thing that was really affecting her in a big way, and that was her leg pain. And she's at the point where it was so debilitating she could hardly get through her day, and she has her own businesses on her feet frequently all day long, and to the point that pain in her legs would bring to tears. And I said, why don't we just try a series of Prolozone here? Maybe there's something going on up in the lower back there that's affecting the legs, like a pinched nerve. So we did a couple Prolozone injections, which are done in the exam room of the clinic, and we have folks either lie on their stomach or lean forward on the exam table with their feet on the ground, and we do a little cold spray and put a little bit of this vitamin mix in, and then follow that up with the ozone gas. And we called her 3 days later, this was last week, to follow up, and she rated her improvement at 90%.
Wow.
And this is a gal that has been debilitated and struggling, I think she said, for 7 to 10 years with this. So at some point, he's starting to lose some hope there as well. And so we will continue to climb with her, and we hope to get to 100% improvement with her. Another really fun case is somebody in the wrists, how impactful there can be numbness in, like a neuropathy, sometimes what we call carpal tunnel, can wake folks up at night. I've seen many folks, when we inject Prolozone into the wrists, that all of a sudden, more recently, and into the elbows, that would wake at night, that individual at night, was improving once we started injections in this area. So again, wildly incredible and so exciting to have this option. There's nobody that should be walking around in significant pain they need to know about this and try it, because again, what is it, Dave? It's optimizing oxygen utilization in the mitochondria. It's increasing the improvement of the electron transfer down the electron transport chain. It, in many cases, can stimulate stem cells, which are really good for helping the body on that healing pathway. And in the combination, it's antimicrobial, boosts the immune system, all these different ways that this treatment can work. Then again, you can apply it through different approaches. We've just started something that doesn't sound so exciting maybe for some, but if you've ever heard of coffee enemas, another approach is rectal ozone, and that is an incredible way to get to the liver for a liver cleanse. And so we have folks coming into the clinic now that we're really trying to focus on fatty liver. Their liver's not working quite as well over the years, so we're helping the detoxability of that liver by supporting it through the rectal ozone. And then you can get into the realm of applying it topically for rashes with the right products, and other products are, even some folks across the country are having their patients nebulize it when you're using the right combination. You don't want to just nebulize ozone, because that would be hard on the lungs and dangerous. But if you're using it in the ozone dissolved in the right material, and that's something you can come in and talk to me at the clinic about as well. We've just seen incredible results with this, with folks in their lung health, in folks that have things like asthma or COPD.
And what an easy way to, you think about a nebulizer, I would assume most people are very familiar with a nebulizer, using it for like bronchitis or something like that. But what an easy way to get oxygen in you by just something as simple as old school nebulizer.
Absolutely.
Yeah.
So it's the whole Bubba Gump shrimp. You can boil it, you can bake it, you can saute it. It's the same thing with ozone. There's so many incredible applications to it. And we're certified with Dr. Frank Schallenberger, is a friend and mentor, and he's the godfather of ozone, and he's been doing it for 30, 40 years now. We've been doing it a year and a half, and we go get our certifications training with him, and what an honor and opportunity to do that, because then we get to share the good news, see all these amazing stories of folks getting their quality of life back with the application of this absolutely incredible approach that everybody needs to know about it.
Yeah, and speaking about something everybody needs to know about, we need to go back onto this topic another week because we're out of time. Health and Human Services Secretary Robert Kennedy Jr. talking about this week, and I will bet you there are very few people that know what their mitochondria score is. And he was talking about things that are harmful to the mitochondria, and if we can get that mitochondria fixed up for folks, what a road to better health that would be for people. You've been talking about it for a long time, and yet I will guarantee you 95% of the population out there maybe don't even know what the term is, and certainly don't know what their score is.
Absolutely, and we can test it and watch progress over the course of time as we work down these healing journeys, because as I always say, we are the educators, we are the folks here in our clinic, the professionals here to draw out that map, provide some options, but the individual themselves is doing all the hard work on putting in the reps, working on healing themselves. But it is certainly gratifying when we apply some of these approaches and we test that mitochondria, which is huge measure of one's health and energy level, for instance, and down the road retest it after we've done some treatments with whatever that approach, whether it's hyperbaric therapy or ozone, or one amazing treatment that we've got is an insulin-based therapy that stimulates that mitochondrial health. In these cases, with these folks that we've been doing this therapy with, we're seeing incredible on this measure. The mitochondrial scores are bumping up 30 to 50% after they've done 28 treatments. And in line with that, guess what? We're seeing improvement in major quality measures of how they're feeling.
Yeah.
That's so cool that this is being brought up now on a national level and in its rightful spot, so more and more people can validate it, legitimize it, because I know what I see. We know what we see here every day.
Yeah.
With our guests coming in, our patients, and the results and the improvements that we see, but it still needs, not enough people know yet, and I'm grateful for that, to hear that.
Yeah.
You're talking mitochondria, Dave. That's crazy.
I know. I was stunned. It was so cool. All right, we got to go. It's thrive, not just survive. Don't just put a Band-Aid on your health. Let Dr. Meyer and his great team help you thrive. And how do folks go about starting that journey, Dr. Meyer?
Yeah, give us a call at 712-339-6024. You can do a complimentary discovery call with me. Did one last night before I left for home, and a prime example of somebody that was spinning their wheels and ready to try a different approach. And so we spend 15 minutes talking about what will that first visit look like and the steps after that. And then if you prefer just to get going and see us, maybe sign up for one of those, some of the Prolozone for ozone injections. You can come right in same day, and we'll talk about it and see if it applies to you. I don't do any charge for the visit. If you decide you come in to talk about Prolozone injections and you don't do it, but if you do decide to, then we can get you going right on. I'll examine that knee and decide, yep, here we go. We'll do that Prolozone and get going with that. And so just give us a call if you want to go directly right into that. Otherwise, it's typically an hour-long visit that we do, and that can be done without a discovery call if you'd like. And we are at 3305 Berquist Avenue, off Highway 71 in Spirit Lake, ready to get everybody feeling better.
Very good. Dr. Meyer, have a great day, and we'll chat again soon.
Okay, thanks, Dave.
Thank you. Thank you, Dr. Meyer. Dr. Bradley Meyer at Okoboji Wellness Clinic.com.